everyone. I am a nursing student from Snead State Community College. A group of us nursing students made a slideshow on type 2 diabetes. In this presentation, we will talk about what type 2 diabetes is, what the normal blood sugar levels are, signs and symptoms of type 2 diabetes, how you can prevent this disease, how you can manage type 2 diabetes, and some state and local information regarding type 2 diabetes. So this is what you need to know. So you may ask what type 2 diabetes is. Type 2 diabetes is when your pancreas does not make or use the insulin. And if you don't know what your pancreas does, it makes the insulin your body needs to function. This results in your blood sugar being in unusual levels like hyperglycemia. Hyperglycemia is another word for high blood sugar. This can start being problems if not controlled correctly. Your normal blood sugar should be in between 70 to 100 milligrams when you check it on the glucose reader. People with diabetes, their blood sugar will be 125 milligrams or above. Fasting blood sugar means you have not ate or had anything to eat since overnight. Post-meal blood sugar is right after you eat. Your blood sugar will be elevated even in a non-diabetic person. The signs and symptoms of this disorder are gradual and progressive. Some people who have type 2 diabetes do not even know they have this disease. Some common signs and symptoms of type 2 diabetes are excessive thirst. You will not be satisfied with just one drink. You will want many more and your mouth may be dry. Frequent urination. You may have to go to the bathroom multiple times a day. You will be tired and not have much energy to do anything. You will have poor wound healing. This is because you don't have enough glucose to help heal wounds. You could have the sensation of pins and needles on your hands and feet. You also may either lose weight or you can also gain weight for this disease. The people who are more at risk for developing type 2 diabetes are anyone who has a body mass index of greater than 25, which are people who are overweight. If you have a family history of people having type 2 diabetes that runs in your family, over the age of 45, if you're physically active less than 3 times a week, if you have been diagnosed with metabolic syndrome, you are at risk for type 2 diabetes. Also, you are at risk for type 2 diabetes if you are African American, Hispanic Latino, American Indian, or Alaskan Native. Did you know that diabetes is the 7th leading cause of death in the state of Alabama? How do they test for diabetes? There are a few different ways to test for diabetes. First is to test your A1C. This is a blood test that tests your blood sugar level over the past 3 months. Next is the fasting blood glucose test. This measures your blood sugar after you have not ate anything overnight. And lastly is the random blood sugar test. This is a blood test that is tested randomly after you have ate and the results are greater than 200 milligrams. So you may ask, what are some ways I can prevent type 2 diabetes? Well, you can stay active by doing any type of exercise. This could be riding a bicycle, running or walking around your neighborhood or on a track, or doing any type of sport-like activities. You can manage your weight. You can make healthy food choices, which is following the ADA diet, which means the American Diabetic Association diet. Another way to prevent type 2 diabetes is don't smoke, or if you do smoke, try to quit. You can also drink plenty of water a day, at least 64 ounces, which is equal to 8 cups a day, unless your doctor has told you not to drink that much water a day. And lastly, you can check your blood sugar levels daily by and recording them in a journal and making sure they are in between the level of 70 to 100 milligrams.
Hey y'all, I'm Katie. I'm another nursing student. So I'm going to pick up where Nikki left off and start off by talking to you about the Healthy People 2020 goals. So Healthy People is a federal government prevention agenda for building a healthier nation. They identify the most significant preventable threats to health and establish these goals in order to try and reduce them. So our first goal is to reduce the annual number of new cases yearly. Our second goal is to reduce the death rate among those with diabetes. Fact: across the United States, 34.2 million people have diabetes. That's about 1 in every 10 people. And at least 1 in every 5 people don't even know that they have it. Interventions to achieve Healthy People 2020 goals. Dieting. Dieting is our main priority here. So we're going to avoid simple carbohydrates such as anything processed, anything with sugar, pastas, white bread, and flour. We need to focus on complex carbohydrates such as brown rice, whole wheat, quinoa, oatmeal, fruits, vegetables, and beans. Our food groups to focus on, as stated above, whole grains, meat, vegetables, non-sugary drinks. Okay, this is just a demonstration of the diet we have previously talked about, where we said we needed to focus on complex carbohydrates and try and avoid the simple carbohydrates. So this plate shows brown rice, our meat for our protein, our vegetables, fruits, we have some apples, and our glass of milk. So with milk we need about 8 ounces. We need to make sure that we are drinking non-fat or low-fat. Intervention to achieve Healthy People 2020 goals. Exercise. We need to be exercising. Whether it's walking, aerobics, things like yoga, resistance training, high-intensity interval training, sports, just any kind of sports, anything to keep you active, like cycling or even swimming. Swimming can be fun. We need to do this at least 3 times per week. Ideally, we need to do it more than that, but 3 times is just a minimum. So here's another fact. In adults, type 2 diabetes accounts for approximately 90 to 95% of all diagnosed cases of diabetes. Benefits of different types of cardio. High-intensity interval training can be done in less time, can be performed nearly anywhere, and it burns lots of calories. Low-intensity steady state is easy to do. It's lower risk of injury. We could do this maybe if we have any other comorbidities, or for the elderly, this will be easy to do. It also still burns calories. Moderate intensity steady state improves endurance. There's a wide variety of options, multiple things that we can do. Still burns calories. Fasted cardio. It's easy on the stomach, can be done first thing in the morning. Again, still burns calories. Group classes. So if you're hesitant to start working out again, this will be great for you. You might can get a friend or a family member, someone to just go with you, kind of makes it a little better. If not, the group classes are still a great thing. You can befriend some of these people. They may feel the same way as you. Also, the scheduling holds you accountable. Like I said, it's fun with friends. We're still burning calories and we're doing something for ourselves. Active rest workout is performed between sets to shorten workout time, prevents workouts from getting boring, and still burns calories. So sometimes when we do things repetitively, we kind of get burnout on it. So this will be great for you if you have a problem with that. And which type of cardio is the best? The one that you actually do. So whether it's this or just getting out and walking a little bit a day, anything helps. Diet issues. So like we said before, it's no secret to any of us that we are limited when it comes to healthier food choices. Lack of accessibility to adequate food locally is 13%. State is 16%. So solutions. If we had better options, if we had more options of healthier food, maybe grocery stores sold more healthier foods, or if we had a specific grocery store with only healthy foods, this would make a big difference. Some more data from local and state population. Obesity, 32% locally. Obesity, 36% statewide. So locally we're a little bit less than the state overall, but still a little too much. Poor health locally, 21%, and poor health through the state, 22%. So still not much difference there. Exercise issues. Lack of accessibility to exercise opportunities. Local, 59%. State, 61%. Solution. So what can be done about this? What can we do about this? Well, from the state aspect, I think that they are doing a lot of great things for us. Slowly but surely they're renovating our parks, completely redoing them, giving us new tracks to walk wherever they can find a location for it, or just completely building new parks. This will have a huge impact on our population. It'll get people out, get us more active. It'll be great overall. Why diet and exercise? The death rate due to diabetes, the diagnosis of diabetes, and reduction of numbers in both. So we need to diet and exercise regardless to try and prevent the diagnosis of diabetes, but also we have a fact for you down here. Fact: the risk of death for adults with diabetes is 60% higher than for an adult without diabetes. Preventing type 2 diabetes. So if you have pre-diabetes, you can lose weight by eating healthy, being more active, and this can cut your risk of getting type 2 diabetes in half. That is huge. A lot of people don't know that they have pre-diabetes. I think the statistics now say that every 9 in 10 people don't even know that they have it. So pre-diabetes is just when your hemoglobin A1C is a little higher than normal, but still not high enough to be classified as a diabetic, or with type 2 diabetes anyways. And as Nikki said earlier, the hemoglobin A1C is a long-term measure of blood sugar. It's the easiest way to test for diabetes. So this is usually what your primary care physicians will do. So let's just go over these labs here. Normal A1C is anything below 5.7%. Pre-diabetic A1C is 5.7% to 6.4%, and type 2 diabetes is 6.5% or higher. Need more information. So if you're needing more information, I would suggest either going to or calling and speaking with your healthcare provider. Sometimes it's easier to do this because if you have questions, you can ask them, and overall they can just explain things better to where we get a full understanding, whereas if we go to a website, we can read it, but we just don't really retain it just as good. But these are very helpful resources. So we have www.diabetes.org, www.cdc.gov/diabetes, www.alabamapublichealth.gov/diabetes, and the last we have www.countyhealthrankings.org. And this is where we got our statistics for the length of life and the access to healthy foods and dieting. So this last slide, this is just our clinical group with the pandemic and just life being a little crazy right now. We couldn't really get together to take a group picture, so we just sent an individual. So this is Dylan. Dylan, when he finishes, he'll either be probably in ICU, CCU, or step-down unit. He likes critical care. This is Kayla. She loves psych, mental health. She'll be a great psych nurse. This is Shannon. I'm not sure if she's really decided what she wants to do yet, but she would be great in geriatrics or pediatrics. She has such a kind heart. This is Nikki, and like me, she likes excitement. She is interested in the emergency department. And then this is me, Katie. I plan on staying in the emergency department. I like the excitement. Alright, well, thank y'all for listening to our video. Make sure, tell your family and your friends about all of the facts that we've included here. It can really make a difference.